Hi, today my presentation will be about schizophrenia. Schizophrenia means a chronic and severe mental disorder that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with reality, and symptoms can be very disabling. If we cut the word schizophrenia in two parts, schizo means split and phrenia means mind. So it's a splitting of the mind. In other words, it means a fragmented pattern of thinking, not a multiple personality. So the symptoms of schizophrenia are unique to each patient, and we have three major areas of symptoms, so the positive, negative, and cognitive symptoms. For the positive symptoms, we have psychotic symptoms, delusions, like people could think that aliens controlled their mind. We have hallucination, disorganized speech, or disorganized or catatonic behavior. For negative symptoms, we have removal or normal processes, decrease of emotion, loss of interest, and people could have a decrease of motivation also. For cognitive symptoms, we have memory, learning, understanding, or symptoms could be more subtle, like difficult to notice. Some people could remember things that we usually can't. Also, schizophrenia have three phases: the prodromal phases, active phases, and the residual phases. Residual phases. The prodromal phases includes withdrawn. People spend their time alone or are similar to depression or anxiety. For the active phases, we have more severe symptoms like delusion, hallucination, disorganized speech, disorganized or catatonic behavior. For the residual phases, we have cognitive symptoms like not being able to concentrate or being withdrawn again. So it remains to the prodromal phases and it makes a will. For the diagnosis, a person has to have minimum two of the following symptoms. So it goes with delusion, hallucination, disorganized speech, disorganized or catatonic behavior, or negative symptoms. But to be diagnosed with schizophrenia, a person has to have at least one of these following symptoms, so delusion, hallucination, or disorganized speech, but can't have these two following symptoms, or disorganized or catatonic behavior, and negative symptoms. Also, to be diagnosed with schizophrenia, symptoms have to ongoing for at least 6 months, with the three phases, so the prodromal phases, active phases, and residual phases. For the causes of schizophrenia, mostly are unknown, but could have something to do with the increase of dopamine. Also, the environment, early or prenatal infection, autoimmune disorders, also genetic, like the heredity in family, and it could be simply a stressful situation. For the epidemiology, men are slightly prone to develop schizophrenia in the mid-20s, and for the women, they are more prone to develop schizophrenia in the late 20s. But for women, it's less severe, and because women develop secrete estrogen, and it regulates dopamine. For the treatment, they're kind of difficult because for the antipsychotics, they can be effective for reducing symptoms, but it have high costs and side effects. But also we have cognitive therapy for delirium and hallucination, and it could be beneficial and could help with medication. I will end my presentation with 3 myths and their facts. So my number 1 myth is that schizophrenia is a rare condition, and the fact is that schizophrenia is not rare. The lifetime risk of developing it is widely accepted to be around 1 to 100. For the myth number 2, people with schizophrenia are dangerous, and their fact is, although the delusional thoughts that hallucination and schizophrenia sometimes lead to violent behavior, most people with schizophrenia are neither violent nor a danger to others. And my final myth, schizophrenia is caused by bad parenting or personal weakness. And the fact is, schizophrenia is a medical illness caused by a variety of factors including genetics, stress, substance use, and trauma. So it was my presentation about schizophrenia. Thanks for listening.